Hi, my name is David. I'm the nurse who can take care of you today. Okay, I'm gonna wash my hands real quick while I'm doing that. You can go ahead and tell me your name and date of birth?
Maddie McCauley, August 18th, 1999.
Okay, good. I'm gonna go ahead and provide for some privacy and go ahead and close that up, okay? So I'm gonna ask you a series of questions. First one is, what's the name of your first dog?
Winston.
Okay, and what did you have for lunch today?
Chicken Caesar salad.
Okay, so if you're walking down the street and you saw a mailbox with a letter sitting next to it, and the letter wasn't in it, what would you do?
Pick it up and put it in the mail.
Okay, good. And if I said to you, the grass is always green on the other side, what does that mean?
There's better stuff on the other side.
Okay, good. All right, so she's saying no times 4. We'll be conducting an assessment of your whole body, head to toe, okay? And in doing so, I'm gonna begin with your head, and pretty much with your toes. And in the process, we're gonna be checking your skin too, okay? So the skin is checked throughout. First thing we're gonna do is check for the head. Checking the head, I'm noting for any lesions, deformities. It is symmetrical, it is round. The hair is properly distributed. The color is brown. There's nothing noted, no scabs or scars or anything like that on the head. So the next thing we're gonna do is we're gonna come down to the eyes. First thing I need to do, if you could stand up for me. Go ahead and look at the Snellen eye chart, which is gonna test for cranial nerve 2, which is the optic. Cover your right eye, and let me know the smallest line you can read.
F-E-L-O-P-Z-D.
Good. Go ahead and cover your left eye. Same thing.
F-E-L-O-P-Z-D.
Good. All right, go ahead and have a seat for me. Okay, so we go ahead and test it for the optic. Now we're going to go ahead and test what will be cranial nerves 3, 4, and 6. First thing we can do is check to see if your pupils are pearl. Okay, so keep your eye on me. Good. Good. Both pupils are reactive, round to light. We're going to check for accommodation now. Okay. What I need you to do is go ahead and look over at the chart. When I tell you to, come back and look at my pen line. Go ahead and do it. Good. Pupils do react appropriately. Now we're going to check for confrontation. Boom. Good. So the sclera is white. There's no drainage noted. They're equal and symmetrical based upon the size of her face. So the eyes appear to be good. The next thing we're going to do is check for what's called the red light reflex. Okay, so I'm going to look into your eye. Red reflex noted. Again, into the left eye to left eye. Good. It is noted. So the eyes are good. So the next thing I want you to do is I'm going to check your nose. Okay. So the nose is symmetrical. There's a bandage on there. I'm assuming you probably had some sort of procedure this week. So I'm going to check up into the nares and see if there's anything noted. So I go ahead and put it up. Good. Up. Good. No drainage, no bleeding, no deviated septum. There is the mucus is normal. So we're good there. So the next thing I'm going to do is I'm going to check your ears. Okay. So I'm looking for the ears. They're symmetrical in height off of the eyes. I'm checking there are some piercings going. There's no drainage. There's no lesions. There's no warmth or redness. I'm going to check inside. So pull up and back to look into the canal. Good. The tympanic membrane is opaque. It is the right one, so it is at 5 o'clock. I'm going to come over and check the left. Up and back as well. Good. Tympanic membrane is also clear. It is opaque in color. It is at 7 o'clock for the white reflex on this side. Again, there's nothing noted on the skin either as we go down. So the next thing I'm going to have you do is I'm going to check your facial cranial nerve, okay? So what I want you to do is cranial nerve 5, and I want you to raise your eyebrows, close your eyes, open your eyes, puff out your cheeks, smile, show me your teeth. Good. Frown? Good. So while you're here, go ahead and clench your teeth. Good. So I've checked for the trigeminal nerve as well. Cranial nerve 7, and I'm going to do what's called a wisp test. You feel all 3 of those?
Yes.
And all 3 of these?
Yes.
Good. Okay. So we've also checked for the trigeminal nerve and your mastoid. So if you can stick your tongue out for me, wag it back and forth. Good. That's the hypoglossal, which is number 12, which is clear. So I'm going to check what's called your olfactory, your first one, which is sense of smell. Okay. So let me know if you can smell that. What do you smell?
Alcohol.
Good. All right. So the cranial nerves are all intact for there, as well as the ears, the eyes, the nose, and the mouth. Everything is symmetrical, no lesions, scars, bruising, redness noted, warm on the face, the skin on the face is warm, pink, and dry. The next thing we're going to go ahead and check for are your lymph nodes, okay? So I'm going to check for the preauricular, the postauricular, the occipital, the tonsillar, the submandible, the mandible, the deep cervical chain, supraclavicular, postclavicular, supraclavicle, cervical, post-cervical, supraclavicular. Okay, all good. While we're here, go ahead and lift up for me. Good. So we've also checked for the spinal nerve, spinal accessory nerve as well. So the next thing I'm going to do is I'm going to look. There's no JVD noted, no tracheal deviation. Trachea is in line, midline, and again, as we're looking at the skin down, there's no lesions, no redness, no warmth, no apparent infection noted. The one thing I'm going to go ahead and do is check your test your hearing with the whisper test. Okay, it also tests one of your cranial nerves. So I'm going to whisper something, and you tell me what I say. Okay.
1, 2, 3.
Check this side.
A, B, C.
Good. So the cranial nerve is also intact there. So the next thing I'm going to go ahead and do over here is I'm going to go ahead and check your lung sounds. Okay. So every time I move my stethoscope, you take a deep breath. Okay. Good. Clear bronchial bilateral. Good. Clear bronchial vascular bilateral. Good. Clear vascular bilateral. Can you go ahead and stand up for me? Turn around. We're now going to check the lung sounds on the posterior. Again, same thing, okay? Deep breath. Deep breath. Deep breath. Good. I'm going to test for CVA tenderness. Any tenderness there?
No.
Any tenderness here? CVA tenderness?
No.
Regarding inflammation of the kidneys. Okay, while you're here, I want you to go ahead and say 99.
99.
There you
99. 99.
Good. So go ahead and have a seat for me. Good. So the next thing I'm going to test for is going to be your heart tones. Okay. Again, with my diaphragm, check for the aortic, the pulmonic, Herb's point, tricuspid, the mitral, and while I'm here, mid-clavicular, fifth intercostal space, I'm going to listen for the apical pulse. I'll count this for 1 minute. Now I'm going to listen for my bell. Same thing. Aortic, pulmonic, Herb's point, tricuspid, mitral. Good. All heart tones are normal, no S3, S4 noted. I did hear S1, S2, left up D. So the next thing I want to do is go ahead and do your abdomen. Okay, if you lay down on the floor for me. So I note that the abdomen is flat. There's no distension. There's no lesions. There's a mole noted. Other than that, there's no redness, no swelling, no lesions. The umbilicus is in place. There's no protrusion. There's no noted hernias, anything along those lines. After inspection, we will do auscultation. We'll begin in the lower right-hand quadrant. normal vowel sounds are noted, not hypo or hyper active vowel sounds. I'm going to go ahead and percuss, noting dullness, hyperresonance, or timpani. Now I'm going to palpate softly in all 4 quadrants. You tell me if any of this is tender or painful.
No. No. No.
Okay, all 4 quadrants of the abdomen are palpated, soft, non-tender. While we're here, because you're laying down, let's go ahead and check your range of motion of your hips, okay? So go ahead and lift your leg up for me. Good. So we're going to go ahead and abduct, adduct, go ahead and push against me, go ahead and pull. Good. Next, go ahead and bring this one up. Again, we're going to adduct, abduct, push against me, pull. Good. Range of motion is good. Hips are intact and stable. Go ahead, stand up for me. You guys sit back down. Okay, while we're here, we're going to go ahead and test your, or feel for all of your palpable pulses. Okay? So the first one that tests for is the carotid. Never do these together. We always do them separately so you don't pass out. Good. +2 normal regular. We're going to head chest brachial bilat. Good. Radial. Good. Femoral noted. We're going to go ahead and we don't do popliteal because they're very difficult and most people can't feel them. We're going to do posterior dorsi. Dorsi pedialis. Good. One thing I want to remember and not forget is, can you open your mouth for me? Good. Say ah. Good. Vagus nerve is intact. I've also checked for the gag reflux, which is a glossal. Go ahead and smile for me. Good. Teeth are white. They are all noted. There are none missing. Go ahead and open your mouth. Lift your tongue up out of the way. Good. No abnormal mucus or anything. Saliva is good. There's no bleeding, no lesions. All teeth are appropriate. Cleanliness is white. Nothing else noted inside your mouth. You still got your tongue for me? You mind go back and forth? Good. Just in case you miss hypoglossal cranial nerve number 12. So go ahead and put your arms like this for me. Push forward. Good. Pull back. Good. Squeeze those fingers. Good. Out. Up. Fist. Down. Fingers. Good. I don't think we tested your shoulder. Go ahead. Up. And back down. Good. Stand up for me. Good. Range of motion. Good circumvention on both shoulders. Go ahead and have a seat for me. Go ahead and lift up. Pull back. Good. Push forward. Lift down. Good. Can you put your feet up for me? Okay. Push on gas pedal. Pull back. Good. Go ahead and stand up for me. Do a toe to heel walk, checking for your gait, whether it's abnormal or not. Good. Come back. Good. Okay, while you're standing up, go ahead and take your heel and scratch down each one of your shins. Good. Go ahead and stand up. Close your eyes. Hands down by your side. Good. Negative on Romberg sign. Go ahead and sit down for me. You have your feet. Good. Other. Okay, good. We have a negative Babinski. The next thing I want to test for is put your hand out, upside this way. So I'm going to draw something in your hand. Close your eyes and tell me what I'm drawing in your hand.
Circle.
Okay, good. The next thing I'm going to do is I'm going to put an object in your hand. You tell me what that is. This was graphophagia.
Paperclip.
Okay, good. Sterophagia is also good and intact. This is my tuning fork. Okay, I'm going to test for whether you can feel the vibration. Okay, so
Yes. Yes. Yes.
Great toe, bony prominence.
Yes.
Good. Let's just go over, make sure we didn't miss anything, okay? So we touched on the hair, the eyes, the nose, the mouth. We tested all of your cranial nerves, all 12. We also tested your, and felt for, palpated your lymph nodes. We checked for drainage and any lesions or anything in your eyes, ears, nose, and mouth. No bleeding, no drainage occurred. We did no piercings, no scars, no tattoos, except for the scars on your knee. You had bilateral grip strength. All your range of motion was correct. Abdomen was palpated, soft, non-tender. Listened to normal bowel sounds. All heart tones were taken care of. Checked for CVA tenderness. We checked for the back. Oh, stand up for me. I forgot one thing. Can you just turn around and bend over for me? Good. No kyphosis noted. No scoliosis. I'm sorry, no kyphosis, no lordus noted. Stand up. Lordus would be a sway in the back. It's not there. Kyphosis would be here. Good. You can see for me? So I'm just making sure that we covered everything that we need to cover, okay? We checked range of motions, biceps, triceps, wrists, fingers, knees. Oh, I didn't check. Just one thing. So I need to check your reflexes real quick, okay? Good. So we've tested both of those. We can also do it on your elbows, although it's not on my thing. You can do it on the elbow. Testing both of those as well. You can do it on the back here too. So we checked for your reflexes as well. We did Babinski, we did your Romberg test, we did the Snellen and eye chart. I think we covered everything. All right, this concludes our assessment.